like to introduce our next speaker, Dr. Jason Martin, who goes down in a group of fellows as probably one of the best fellows we've ever trained at Vanderbilt. He is faculty at Meharry Medical School, and he's going to bring the human element to the story. He had family who experienced the disease of idiopathic pulmonary fibrosis, and he's going to share his story with us this morning. Jason, thank you.
Good morning. Thanks for having me. Lisa and the PFF, thank you so much for the invitation to participate. And it's great to see a lot of my mentors here today, Tim and Dr. Lloyd, Gordon. Thank you all so much for your leadership and mentorship over the years. I really enjoyed Gordon's talk and Kevin's talk about the macro state of clinical research and pulmonary fibrosis research. And what I want to try to do is put a human face on this disease and tell you the story of my dad. No disclosures to make financially, but I do have one disclosure to make. I did bring some water in case I have trouble getting through this talk. I'll take a step back. It's still, a pretty raw experience. But it's an experience of hope and an experience of a lot of joy, and so I hope that you all find it to be positive as well. This is my dad. This is Terry Martin. He was born in 1950. Lived a great life, was diagnosed with IPF in 2012, had a double lung in 2013 and passed away in 2014. But his story is not a sad story. His story is a story of living, it's a story of hope, and it's a story that I want to share with you guys, and hopefully it will honor his memory, it will inspire the researchers in this room to continue their work, and it will inspire the patients in this room who are going through this disease right now. Dad was a very happy guy, if I can get it to click here. Yeah, very happy guy, basically a jovial person. This is my stepmother, Julie. They were married for 20 years or so before this picture was taken. This is in 2011, before he was sick. Had never really had any medical adversity in his life, had a little bit of weight on him. He would often in a self-deprecating manner, tap his belly and say, "It's hard to hide all this prosperity," which was pretty amusing. He had been a smoker. He'd smoked about 2 packs a day for 20 years, but had stopped smoking 20 years before any of this stuff popped up. And he had single vessel coronary artery disease. He had had some shortness of breath in the early 2000s that prompted him to have a cardiac evaluation. Long story short, he had a cardiac catheterization, had a stent, and then said he had a warm and fuzzy feeling afterwards. All the dyspnea, the shortness of breath, it all went away. He was back to normal and feeling great. Unfortunately, in 2012, the dyspnea, the shortness of breath, started to sneak back up on him again, and it was different this time. He had a little bit of a cough with it. His impression was that it was his heart giving him trouble again, and Dad was very private about his health care, so he wasn't telling me, his pulmonologist son, about his shortness of breath. Which is just the way our relationship worked. And so he went to his heart doctor, and of course, heart doctors do what heart doctors do, and he had another cath. And he had some lumpy, bumpy coronary artery disease, but nothing to explain his new symptoms. And so he went, and his diagnosis was delayed for several months, I learned retrospectively, as he's going to different practitioners trying to find out what's going on. And so, much like Kevin told us, his diagnosis was delayed probably half a year until he told me this story, and I said, "Dad, I know a guy." He lived down in Mobile, Alabama, and I said, "Go see one of my classmates, a guy named from med school, Lawrence Bedsole, who trained at UAB. He's an excellent doctor." And he went and saw my friend Lawrence, and I emailed Lawrence in advance of that meeting, and I said, "Hey, my dad's coming to see you. He's short of breath. He's overweight. He had single vessel coronary artery disease. He used to be a heavy smoker. It's probably just run-of-the-mill multifactorial dyspnea. I hope it's something simple." And, it turned out to not be something simple. Lawrence called me a couple of days later, and he said, "I think your dad's got pulmonary fibrosis." And, of course, with my dad's permission, he made that call. And immediately I'd go into doctor mode, which was not the place to be, right? You want to be in son mode. But I'm looking at the imaging, and gosh, this does look like IPF. And, I'm trying to put Dad in a box. I'm like, is he going to be the person in curve A who is going to have a rapid progression and be gone in a year? Or is he going to be someone who has pulmonary fibrosis and lives with it and does well? And these are the questions that Dad was asking me about his diagnosis. And at this point, Dad and I had to have a sit down, and I said, Dad, I'm not going to be your doctor. I'm going to be your son. And we're going to let the doctors figure this out. And so I stepped back from the situation, and I just happen to know some people who know interstitial lung disease. And I sent Dr. Lloyd an email, and of course the next week he arranged for my dad to come up to Vandy and was seen. It was fortuitous at the time that Mark Steele had recently come over from Duke to Vanderbilt, and he was familiar with the transplant program at Duke, because my dad came up, the diagnosis was confirmed, but he was not a candidate for transplant at Vanderbilt for a number of reasons. But Dr. Steele suggested that we go over to Duke for evaluation. So we did that. We went over there. This is September of 2012. Just 2 months later, we were, you'll recognize this as the Duke Chapel. We were on Duke's campus, and we were there for basically the biggest audition of Dad's life, the biggest tryout of his life. We knew that and looking at his clinical course over the previous months, knew that he didn't have a ton of time unless we were able to get a transplant. And so we went to Duke, and it was an incredibly, incredibly hopeful place. And this is not supposed to be a Duke commercial. This is any lung transplant center, any healthcare center, any healthcare provider for a patient with this disease. You guys who treat this disease are a blanket of hope for these patients. And so coming here was a really special thing. Going through the pre-transplant evaluation, I would say it was a saga. You go and you have this week where it's completely planned out. You get a schedule at the beginning of the week, and you're with a team of other patients with lung disease of all different types from all over the country, and you're going through this evaluation process to see if you're a candidate for survival, basically, a lung transplant. And so in that crucible, you make some incredible friendships, and that's one of the positive things I want to share with you guys about this experience. The people that we met going through the transplant process with us in that room on that Monday morning are people that we still communicate with today. It's just such an incredibly intense experience. So Dad went and he had his prehab. He met with respiratory therapists and physical therapists and psychiatrists and medical doctors and surgical doctors, and he had a CT scan and an echo and nuclear perfusion studies and cardiac MRIs and esophageal manometry, and all these things just poked and prodded all week long. And the end of that evaluation, we did a little sightseeing on the day that we were to go home, and Dad wanted to tour the chapel, and he took his oxygen off, and I told him not to do it. He was on a lot of oxygen. But the take-home message for Dad was really best summarized by his thoracic surgeon, who came into the room at the end of all the evaluations and said, "You might be a candidate, but you weigh 275 pounds, and he tapped him on the stomach and said, "It's not going to happen unless you get to 210. So 211, you succumb to IPF. 210, you get a transplant." Now, I was not confident that my dad had the ability to get through that. He had never really lived a particularly healthy lifestyle, was never one to exercise. I'm not sure he knew how to eat well. And that's not a hit. It's just, it is what it is. It's the way he grew up. But Dad took a different approach to this. Dad said, "Well, we're just going to lose 65 pounds, said the man who can't walk to the bathroom without coughing. But he did it. I was so proud of him. He set his mind to it. And so after that initial session in November where we had the pre-transplant evaluation and he was given his mission to lose weight, he went back home to Mobile. And over the following November, December, January, first half of February, every 2 or 3 weeks, he drove back up for follow-up appointments, 11 hours each way. And he set his goal to lose 2 or 3 pounds a week. And he did it. He was really remarkably successful at it. This is Dad during one of his return trips to the clinic in Durham. He's waiting here to see, I think, Stephanie Norfolk, who was at Duke at the time, but is now at Vanderbilt. And also John Reynolds was another one of his doctors, amazing folks. This was not just the Duke Clinic, but I think all clinics. Like I told you, they're beacons of hope for people who are in this predicament. And we would go in, and because the emotions were so intense and everything was so raw, you got to know all the people in the clinic, the front desk workers, the nurses who checked the vitals, the therapists. Everybody was a part of the family, and they all knew us by name. So Dad, knowing that every pound mattered, when it came time for the weigh-in, he would start taking clothes off. And they were like, sir, you don't have to do that. You really don't have to do that. And yet he persisted, and so they had a special area for him to weigh in because the pounds mattered. This is our last week in Mobile before he got relocated to Durham. We loved Mardi Gras. It turns out that oxygen canisters make a great place to hang beads. But the point of this slide is to share with you how intense our family life got to be. That was one of the great things that came from this. We appreciated every moment. Next was the move to Durham. This was a big moment. We had been working for this. He got the call. His disease had progressed. I'm sorry. Thanks, guys. His disease had progressed to the point where it was time to go to the transplant center. And this is the Center for Living. Wow, what an amazing place. I hope every transplant center has a place like this. As part of the prehab program, before you get your transplant, you have to do 25, I think, 5-hour sessions in this place. And it doesn't matter if you get hypoxic, they'll throw a high flow contraption on you and keep you going. They're going to work you to death. Not literally. They're going to work you to get you to your goal. To get you to your goal. It's an incredibly hopeful place. At this point in Dad's journey, we would drop him off like you drop your kids off for school every day, and he would roll in with his lunch and his oxygen, and we'd come back and pick him up in the afternoon. And I snuck up on him one day while he was exercising and took that picture. This was a hard time for Dad. He was getting angry, to be honest. He was depressed. He had to move away from his home. He was removed from his family. He was getting to a point where it was either going to be a 1 or a 0 for him in terms of survival. And yet the Center for Living just inspired him every day. He would walk out of that place recharged. And partly it was because of the way the patients were mixed in this building. So Dad was going through his program, and he would come home, so-and-so didn't come to therapy today. They got their lungs last night. And that would recharge him. Or so-and-so came back today. They made it out of the hospital. They're off oxygen. And that would recharge him. So it's a really special place that kept him going. Now, I had a lot going on. I have 3 young daughters who have like 8 events a day they have to be transported to. I myself am trying to run an intensive care unit with 2 other guys, and so I have a very busy and full life here in Nashville. So I couldn't always be in Durham. And so Dad would often send me pictures to let me know that he was doing okay. I think 1, he wanted to let me know he was doing okay, and 2, he wanted me to know that he still had a sense of fashion. But as the months went by, the pounds did fall off, and he got very close to his goal. I told you during this time we had lots of family time, so we would spend weekends in Durham and go over there. And these are my 3 daughters at the time. You see my youngest there, she's really, really upset about something. It turns out all she wanted to do was hold the broom. And so here she is holding the broom. So my dad knew that I was at work. He knew I was working hard. And he would often send me thumbs up pictures randomly. Just, I'm okay. I'm losing the weight. I'm doing what I need to do. And I really appreciated that. It was very uplifting. Finally, in May 2013, less than a year into this journey, he's gone from, a 60-something-year-old with shortness of breath to being in a foreign city on a lung transplant list. And it was really, I can't describe it really. It was an intense time. You're sitting by the phone, you're waiting to see what happens next. At Duke, when they bring you in for a lung transplant, they bring 2 people in at a time. So you have a primary and a backup, and I don't know if other centers are that way. But Dad was often the backup to a young man with cystic fibrosis. And on the 4th night that we got called in, and this is one of our many trips to Durham, we get the call, we fly over there. It's 4 in the morning, if you can see the clock in the corner. And often we would go home. So I went home in the morning, I think of June the 4th, after another false alarm. But it turned out that night the primary guy got his lungs. So Dad was next up. And I couldn't be there for it, but he went the next night. And I got a thumbs up before they took him back. And he did great. I don't know why I'm upset. He did great. He got his bilateral lung transplant. He was very sick afterwards. I mean, Swan-Ganz catheters and balloon pumps and 6 chest tubes and intubated. And he was really a sick guy for a while. But on day 3, he was walking around after his double lung transplant. Speaks to the power of early mobility. And by day 6, he was off oxygen with his new lungs. Hadn't been off oxygen in years. He ended up having a lot of small victories along the way. He was really not afraid, but didn't want to have a feeding tube placed. Handling food is sometimes difficult after a lung transplant, but he made it one of his goals to not have to have a feeding tube, and he met that goal. And finally, after 17 days in the hospital, he got to go home, and this is the picture I got on the day that he was discharged. So that was a happy moment. Post-transplant life was awesome. From October until he got sick again in 2014, it was great. This is exactly what we had worked for. This is him at my kids' Thanksgiving thing in November of that year, her parents' and special friends day. Lots of family time, spending time with the kids. It was great. My wife went to school at the University of Kentucky, and there's this thing about Wildcats and Blue Devils, apparently. They don't get along. So she would often caption this picture as $1 million and all I got was this crappy t-shirt. But of course he got a lot more, didn't he? He got another year of life, and we're so thankful for that. You can also notice from this picture that if you're a clinician that his face is a little rounded, right? So he's obviously been on a lot of steroids, and that's because he had lots of trouble with rejection. And despite really amazing effort, and I have no criticisms of the care he got at all. I'm thankful for it. We just couldn't beat it. And Solumedrol and anathymocyte globulin and more Solumedrol and Campath and more Solumedrol, and it just didn't work out. He ended up getting a lymphoma as a result of all the immunosuppression. Dad being dad, as a critical care doctor, I'm thinking about what that means. And I'm feeling like I'm flying into a canyon, right, where the sides are closing in around us. But as a son, I'm just going to be there for my dad. And that was a great experience because Dad was not afraid. Dad was not upset. Dad was so thankful that he had gotten to this point. He had already beaten the odds in his mind. And so he tried chemo and radiation and various things and ended up getting horribly septic and was in the ICU and trached and all these other things. And it was really tough. And then one day, my brother, who was taking a turn in Durham, called me and said, "Hey, Dad wants to go home." And I was like, "Okay, well, I want him to go home too, but what does that mean? Dad wants to go home?" He's like, "No, he's tired. He's going home." And I respected that decision so much because I knew that medically it was the right thing. It's so hard. It's so hard to be on the other side. I've been on the other side of that discussion 100 times. It's so different. But I was very proud of my dad, and so, you know what the last picture he sent me was? A thumbs up. And I know this is a graphic picture, but I want to point out one thing to you. He's smiling. He was thankful for people like you who take the time to research this disease. He was thankful for people who had the disease with him going through the process, who uplifted him when he needed it. He was thankful for the donor who gave him the extra year of life. He was thankful. Thank you.